Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the answer question segment of the week. And Dr. Pane, this question comes from our Facebook page, and question here is, how many years does a SMAS versus a MACS facelift last? So kind of a technical question here. Dr. Pane, what would you suggest in this case?
Well, that's a really good question. We should probably go over a few things. First of all, in terms of all kind of facelift procedures, it's not that they last forever, but then again, they don't really wear off. So what do I mean by that? If you get a facelift operation, you're still going to age. You're still going to have aging changes taking place, but you will always look better than you would have if you had just gone along without having had that procedure done, if that makes some sense. So it's not that they wear off completely, but the effects of it does change a little bit with time. But when you are, removing some extra skin, tightening the underlying structures to some degree, that always improves your appearance than if it had not been done. Now, in terms of the two types of procedures here, one is what they call the SMAS facelift. The SMAS is the superficial musculoaponeurotic structure, which is essentially the muscle layer of your face and neck. When you do a facelift, you have to do something to this layer. There are different things that can be done. Some surgeons like to make flaps out of it, pull it up and cut some off. Others fold it in, tighten it with sutures. Whatever you do, something should be done. Some surgeons go underneath it and do other fancy deep plane things that I don't approve of personally for other reasons. That's a different topic. But as long as you're doing something to that layer, you're going to get the benefit of the facelift, along with proper skin tailoring. The MACS lift, or minimal access cranial suspension procedure, what that is essentially you're pulling up tissue and affixing it to locked on, fixed structures in the face. That works okay as well. Some surgeons do a combination of both things. I don't think either one lasts forever. I think the SMAS procedures tend to give better, more reliable results, and I would say that more experienced facelift surgeons probably do something more toward the SMAS type procedure and less on the MACS procedure, although there's combinations of both. When I do it, I do address the SMAS layer and I affix it up, and I will anchor it when appropriate to the fixed structures. But I do not do like thread lift and other kinds of things which are kind of smaller procedures that you can do, especially with less training. Those are okay, but they're not doing the same thing that a real facelift procedure does. The important thing to realize is facelift procedure lasts a long time. It's the definitive gold standard operation. The recovery, there's no pain with this operation. Recovery is very smooth, and most people do very nicely if you're medically prepared and the surgeon doing it knows what they're doing. You have a very low complication rate, very low problem rate, and you get a good overall result. So I would tell people that that's more what most people are looking for when they get to the point where they're showing enough aging changes where these become something that they want to consider. But again, usually a good in-person consultation about the pros and cons of the different options is always a good idea. And hopefully that will address the main issues with that very good question.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, LinkedIn, Instagram account, or by using the link below. And Dr. Pane, we'll see you on the next question.
Great.